had it?
I looked it up on the internet.
Oh. Because you'd been offered surgery or injections or?
I think they weren't even going to do surgery for you, were they? They said...
No, it's too
there's
dangerous.
nothing- Yeah.
Now, I had a lower back problem, but that wasn't the issue. I realized that most of my issues were in the neck. So if my legs were heavy, it was because of my neck. If my arms were heavy, it was because of my neck. So then when I went and did this two years ago, everything, I felt immediately everything started coming up. Everything was releasing treatment, and that was before and after, and it keeps getting better.
Wow.
No, it's like, it really is a miracle.
Can I just say, you've got a little osteoporosis as well, right? You've got
Yeah.
a little borderline...
Right, I have severe osteoporosis.
So-
And I had that because I didn't lift anything for 25 years. And actually, it's interesting, I just did a retest of my osteoporosis. Nothing's changed on one hip, but the other hip is better. Because I can start lifting things. So now I take things from the bag, and I
Some
take...
weight bearing going through your body.
The weight bearing is now going through the body, so now I have... you know, a sense of getting back to normal. I can cut vegetables. I couldn't cut vegetables before because I couldn't go like this without feeling in my arm. So, you know, I just cut my finger today cutting vegetables.
It was really bad. Yours was one of the worst necks I've seen in a long time.
Thank you.
No, I'm just saying, so the difference
Are you
before
all right?
and after for me was something, I mean, it actually persuaded me to take the final step and buy it in London.
So if you want to test me now, but basically, I mean, I can...
You
I can go as far as I want to go almost.
Do you
I'm still
drive?
afraid, and I can do yoga with my head back. Of course I drive.
Did you drive before?
Of course I drove. I drove like this.
With your head in the middle.
And then looking to the right and looking to the left.
Yeah.
And then what happens when you have that is
Yeah.
because you're so afraid is that you make it worse with the tension.
Yeah.
And then when you stop being afraid, and when I did this treatment, I was very afraid. Okay, because I said, what are they going to rip my neck off, rip my neck off and everything? Now, after the treatment, I want to add this. There was a little massage after the treatment. I don't know if you're planning on
You
doing
on your
it.
tummy or on your back?
On my stomach. Afterwards, there was like few tables for people to lie down on, and you lie down. And first, they put ice on my neck. I was iced with a pad on the neck and the upper back. And then a little bit of massage, and that's it. So the after treatment was about 15 minutes. So you don't leave right away, and the whole time there was like classical music in the background. So it was like
And then
going to heaven.
Was there some sort of an exercise program afterwards?
Yes. Simultaneously, there was a physical therapist who showed you, I'm not doing it right, how to stand like this, you know, how to get up, how to hold this in and everything so that you don't recreate the problem. So it was, you know, the chin in business and the breathing and some things with the arms. But basically, it was not at every meeting. That was about 6 meetings simultaneously. So the whole thing was a package.
Yeah. And it was worse, wasn't it, for a bit?
Yes, when you first do it, you feel sometimes the tingling more. If you had tingling, the tingling would be worse
And I
because...
found that with my patients in
Yeah.
London also because you're decompressing the nerve, so you're getting some...
action.
Yeah, vasonovorum.
So you're getting the movement there, so you're feeling the symptoms, but then it gets, of course, it gets better, but actually, when I was there, then I referred other people in my family, because it turns out that everybody in my family has a disc problem. So my sister did the treatment with the neck and the lower back. She called me after each treatment. She said, I can't believe this is going to get better. I can't believe this is going to get better. And then it got better. In other words, on the way home, she would say, I'm still in pain, I'm still in pain. I can't even walk. Why am I doing this? I said, don't worry. It will be fine. It's just part of the treatment that you have to be ready to have. The nerves are going to be touched. In Malasot.
And she's been better now?
Completely.
And even with her low back, because she would, even
She
though
did
it's got
both.
asymptomatic disc,
She did both.
And she feels better with the low back. as well.
Everything.
Yeah.
Even though she was asymptomatic.
That's what I was saying to you yesterday, is that sometimes, all right, 70% of people have disc problems, which we know that, whether, you know, if you MRI the population, but the question is how the body's adapted for those problems over time. Okay, they're asymptomatic, but actually, mechanically, they've caused all sorts of problems in the back that have broken down over time. So, you know, I often find, I mean, in my experience, that the center often of these chronic problems is an actual disc problem that's been there for a long time.
Now, she had knee problems, and she didn't realize that that was actually from her lower back. And if she hadn't done this, the doctor said they were shocked at the results because she was asymptomatic, supposedly. They said if she hadn't done this, she would be a cripple. and they wouldn't know where it comes from because it was like this close to everything, in the neck and in the lower back. And because of me, she did that. And then I had another relative who went, and they all started doing it, and their insurance covered everything.
Wow.
And then basically it saved her. In America.
And her knee, is that better as well?
Completely. No, she didn't understand where anything was coming from. And then every so often she'd sleep not right, and of course she would never go to a chiropractor or an osteopath because she's in Boston and she doesn't believe in that thing, old-fashioned. And when I told her about this, she said, "Oh, I'm not going to do that, that's horrible." I said, "Come with me and watch." Okay? And then what I can't believe is that when I was there, I was so afraid to come back. I said, "I have to live there." And that's why I told Simeon, "You have to get it, because I don't want to live there. I have to live there in case I need it again."
I think that you forced me to buy it.
You get addicted to it because it feels so good. You get addicted to the feeling of the stretch.
Yeah.
Did you sleep during the treatment?
Did you relax
Oh, yeah.
or you just fell asleep?
I think I just went.
Yeah.
I saw you.
But there was music. There was all sorts of classical
Yeah,
music
we
the
don't do
whole
that.
time to make you relaxed.
I
And
think that's important. I think it's just the whole
I just went totally out.
Can I ask, sorry,
It's better.
if you had 25 sessions and you said you were worse for the first half of them, all of them?
no, right
First-
afterwards of each treatment, and then you feel better by the morning.
So it was hours after each session?
Yes, it was like an immediate reaction.
So
And
within 24 hours you were feeling
yes,
better?
yes, and I was so scared that I was going to make it worse by every movement. That's another thing. You can't.
Yeah.
You can't make it
Tell
worse.
people. And this is one of the things that actually that what's her name was saying yesterday. Anat. She was worried that you need a belt afterwards to wear because you're destabilizing and unstable structure. But Stephen was saying that, both saying that Sally, that actually day-to-day living you put so many forces through these things that.
My brother-in-law, when I did it, he said, "Now I don't have to be afraid to bang you on the head." So he said, he used to go like this to me. Yeah, he said, "Good girl, good girl." I said, "No, don't bang me on the head until it gets to Israel. When it gets to Israel, you can bang me on the head."
Now you know.
So now we can bang me on the head.
Do you take pain medication?
No,
I can't hear
So
the
this
difference
stops.
before and after.
You're taking pain
This is like a miracle, basically.
it's a miracle. And there are so many people who suffer, and there are so many treatments, and actually this is the only one that works. Ultimately, for the disc problems, especially the neck, okay, for the lower back, maybe you could get some kind of other kind of decompression and stuff like that, but for the neck, which is the most difficult and the most dangerous, I think it's the only one, the decompression is the only one that works.
For various reasons, I think low back's a lot more complex, a lot more other things going on. But from our results in the clinic, the neck is just unbelievable.
So I presume you have like MRIs from before
Yeah, but I don't have from after because I don't want to spend money. And why would they give it to me anyway?
because of your such a big improvement.
Some people want them, some people don't.
Well, if you're in England,
Somebody from Kupat
I can have
Maccabi wants to
them
give me a free MRI. Why not?
I can get you one done free in England.
But in England,
I'm
you
not
have
going to go to England. But
So if you come to England, I can
Thank
get you one.
no, I mean, I'm sure that there's a huge difference. I mean, the very fact that I can lift, I have a suitcase that I bring to work
But
because
you
I
don't
have my
even look so
computer.
stiff. I mean,
I just lift up the suitcase like this, but I lift correctly, both hands, because I don't want to get it again. And so I get, like if you sit in front of the computer, don't sit forever without moving around. I mean, you have to do preventative things. So it's like you have to do functional training in order to not make it happen again. And you're aware of it more because you don't want to go through that whole.
Yeah, absolutely.
But it can't happen
what's
again.
nice is, it's nice that it's a platform for people to reconsider their whole. Once they start getting better, you've got an opportunity to actually make the whole thing better in a way that you wouldn't normally have.
It's basically being reborn, and I have to say that when I could lift up my granddaughter, that was for me a miracle. I couldn't lift anything, and I said, I don't want to have any grandchildren because I can't lift them. So anyway, so that's what I have to
That's
say.
fantastic. Thank you so much for taking the time.
Should I do some exercise to show you?
Yeah. it's-
Like what?
What we'll do is
Here.
yeah.
wow, it's beautiful. You do yoga?
Of course now.
Of course.
Thank you.